Hi there! Welcome to the video answers for this set of Part 1 questions. Let's get started. First question. A type 2 diabetic with an A1C of 10 presents to your clinic with many complaints. You're concerned about the effect of the patient's long-term hyperglycemia. What diabetic complications can be attributed to sorbitol-induced osmotic damage? There are two basic mechanisms by which diabetes causes tissue damage. You can have glycosylation of blood vessels, where glucose is just tacked on to blood vessels in the kidneys, retina, and coronary arteries. The other mechanism is sorbitol-induced osmotic damage, which is what this question is getting at. In the cells, glucose gets converted to the sugar alcohol sorbitol, and then, normally, sorbitol gets converted to fructose. But some tissues, like the Schwann cells and the lens of the eye, don't have the enzyme that converts sorbitol to fructose. So the sorbitol gets trapped in the cells and acts as an osmole, drawing fluid into the cells and causing swelling and damage. That's the sorbitol-induced osmotic damage we're talking about here. So damage to the Schwann cells causes demyelination and diabetic neuropathy, and damage to the lenses causes cataracts. So what enzyme converts glucose to sorbitol? This is the enzyme aldose reductase. This is not the key enzyme that is missing in the Schwann cells. That one is sorbitol dehydrogenase. This is aldose reductase, which is responsible for the earlier step, converting glucose to sorbitol. You'll need to know both of these. Next question. What efferent fibers carry input from the brain that influences the outer hair cells of the cochlea in much the same way that gamma motor neurons influence muscle spindles? So we'll talk about the gamma motor neurons and the muscle spindles in the Part 2 videos. But here, we're going to be talking about signals going from the brain to the cochlea. And these are carried by the olivocochlear bundles. They go from the superior olive to the cochlea. Then the result of this input is that you have contraction of the outer hair cells and stiffening of the basilar membrane in the cochlea, which will sensitize inner hair cells to a particular frequency, so that you can deliberately listen for and discriminate specific sounds when there is other background noise going on. So what is the result of damaging the outer hair cells, such as with antibiotics like gentamicin and streptomycin? You get wide deflection of the basilar membrane rather than sharp deflection, and that causes significant hearing loss. Next question. So what is type 2 error? This is where your study results demonstrate no difference between the two groups, when in fact a difference really does exist. So if you did a study that showed that insulin is not helpful in treating type 1 diabetes, your study would of course be erroneous, and that particular type of error is called a type 2 error or a beta error. Next question. A child in India is brought to the doctor with symptoms of muscle weakness, malaise, headache, fever, and hyporeflexia. For the past few weeks he had been swimming in a waterway known to contain sewage. You think this boy has contracted a pathogen via the fecal-oral route. What area of the body is this pathogen attacking to give the neurologic symptoms seen? Unfortunately, these neurologic symptoms are caused by the poliovirus, which is transmitted by the fecal-oral route. The virus replicates in the oropharynx and spreads to the blood to the CNS, where it leads to destruction of cells in the anterior horn of the spinal cord, which ultimately causes lower motor neuron destruction. Next question. What are the risk factors for osteosarcoma? So the answer here is bone infarcts, radiation, Paget disease of the bone, familial retinoblastoma, which is a mutation in the RB gene, the male sex, and age 10 to 20 years. Next question. What disorders can cause cotton wool spots on the retina? First, what are cotton wool spots? They are pale areas on the retina of various sizes, and they look like little wisps of cotton or loose wool. They're basically infarcts of the nerve fiber layer of the retina. Lots of different things can cause them, but by far the most common causes include chronic hypertension and diabetes, specifically diabetic retinopathy. They can also be seen in AIDS and lupus, and rarely in some types of vasculitis, specifically temporal arteritis or giant cell arteritis, Wegener's granulomatosis, and polyarteritis nodosa. Next question. Which cardiac valve is most commonly involved in infective endocarditis and acute rheumatic fever? So overall, it's the mitral valve. Now, in IV drug users who get endocarditis, the tricuspid valve is often the first affected, which makes sense considering that they're injecting their veins, so the blood returning to the heart from a contaminated peripheral vein is going to see the tricuspid valve first. Next question. Name the syndromes below that are common causes of anovulation. Elevated cortisol and central obesity. That's Cushing's syndrome. Amenorrhea plus hirsutism plus obesity. That's polycystic ovarian syndrome, or PCOS. Next question. What neurotransmitter levels in the brain are either increased or decreased in each of the following disorders? This is important to know because it will not only guide treatment, but it also helps you understand why certain drugs are used. So schizophrenia, increased dopamine, especially in the mesolimbic dopamine pathway. Parkinson's disease is primarily decreased dopamine in the substantia nigra, but also increased serotonin and increased acetylcholine. Alzheimer's disease is decreased acetylcholine. Huntington disease is decreased GABA, decreased acetylcholine, and increased dopamine. Anxiety is increased norepinephrine, decreased GABA, and decreased serotonin. Depression is decreased norepinephrine, decreased serotonin, and decreased dopamine. So here we can see that depression and anxiety both have decreased serotonin, and this is why SSRIs are most commonly used to treat both disorders. And last question, what is the underlying cause of DiGeorge syndrome and what are the manifestations? The underlying cause is that the third and fourth branchial pouches fail to develop, resulting in aplasia of the thymus and the parathyroids. Usually, this occurs because of a gene deletion on chromosome 22. Then for the manifestations, they can have tetany, because without parathyroid hormone, they'll have hypocalcemia. They can have recurrent viral or fungal infections, since without a thymus, the T cells cannot mature. And if it is a chromosome 22q11 deletion, you may also see cleft palate, abnormal facial features, and congenital defects of the heart and great vessels. So that's it for this set. See you guys next time.